Baby. Baby. Okay. We are in the hospital. We are in the Paco. Wacko. Baby. Here we go. We are late, and supposedly it's the last patient. So KK have a diarrhea, vomiting. Baby. I forgot how many times we go to see the vet. The vet's name is Carol. Hmm? Yeah. Baby. I'm just gonna get fine. I love you. I hear you. I had a shot with her there. His camera shine. Camera shine. Baby. His name is Cookie. And he lost his family, close friends, auntie, 2 sons. So he started to develop kind of like depression. And this year I bring him to see a regular check and find out that he has a hyperthyroidism. Then later it's kind of like thin. I bring him to see the doctor and find out that he has diabetes, but not severe. I think this comes from the pancreatitis. I try my best, and I take care of him at home. Everything is good, and we come back and check the diabetic again. Meanwhile, the doctor should give us the medicine for nauseous. Maybe he forgot, so I can't get it. So the situation is not good. He's kind of thinner than before. He's so cute. He's kind of shy. Okay. Okay. Love you. Love you. Vậy là mommy chỉ tôi là. Okay. Hổ tệ à mẹ? Hai tệ à? Oh. I love you. I love you, Coco. We are in the Paco Animal Hospital, Waco. It's Coco. Coco is going to see Dr. Carol. So I think this is the 4th time going to see doctor. So it's a checking for his blood glucose. Hello. Okay. Okay, vô thấy dành tất cả. Có pha chào hả? Anh tưởng là cái này dẫn người rồi thôi không sợ. Nè. Baby nè, có hàng chim vậy hả? Thấy được chứ không hiểu. Ok, chim tụ lên. Rồi đâu có thầy. Người ta đều có kể ảnh chân này. That's the eyes. So this is the Waco Animal Hospital. It's so quiet today. Look at this cutie. Look at this cutie. Whoa. Isn't it cute? It's like cotton candy. Hi. Hello. It's a medium size. 我哋去啦，行啦。We go to the now. Okay. Hi. Hello.
Hello.
Okay.
For you guys. How's the baby doing when it comes to eating, drinking?
Oh, okay. He vomiting. He ate at I forgot when. He ate a few hours later. So like 10:30, he throw up. He vomiting, and he kind of soft, still half hard, half soft, and he vomiting for a few days already.
Hello, everybody.
Hi,
Hey.
doctor.
Hi.
So yeah, days, and after eating for a few hours,
no.
not immediately,
Yeah.
but few hours, like sometimes 6, sometimes. I still don't get the WD yet. The WD.
Yeah.
I still don't get it yet, so I gave him the DM, and his glucose is okay. I check it every day.
Great.
But I forgot to give him medicine because he's keep throwing and give him small food. So it's like 16 hours, 16 to 18 hours, the medicine. So these 2 times is late. So I just gave him medicine this morning.
Okay, what medicine was that you gave him?
The math 2.5 for the hyperthyroidism.
Okay.
On the year, and then the insulin 1 unit. That's what you say.
Yeah.
But I cannot find the nurses. I call them. I call Waco.
Yeah.
I don't know. I don't get the prescription.
Oh, let's see
the
if
pharmacy.
It's here. We'll check.
Yeah, I talked to the pharmacy 2 times. They said no, they didn't get anything.
Oh, gee, let's see where it is here.
So
Okay,
this.
there. Yeah, so we can get that for you. Say there it is. There. That's the prescription there. So we'll print that out today. Is he eating?
Eating.
Eating. Okay, got good appetite.
Very good.
Okay, good. And when
he's like.
Yeah.
Like,
good. Okay, good. And when was the last time that he vomited?
Just 10:30.
10:30 today?
Yeah.
Okay.
That's few hours
Check
after.
The last fructosamine that we did.
Few hours after eating. I gave him 7 a.m.
You can type it in at the top.
7 a.m. for the food.
Yeah.
7 a.m. for the food and medicine, and he vomited. Then I gave him. I gave him something to eat, but light, some water to drink, and then we come here.
Okay. And when did the vomiting start? Did you say was that just in the last
few
week?
days, not
few
weeks.
Days.
Yeah. It starts from I think 14, but
Okay.
then stop. It's not often.
Okay.
Sometimes on, then off. It's not really bring me concern. But then
Okay.
these few days, yesterday, the day before, because I have to call. So today, yesterday, the day before, and the day before, more serious. Like it's very strange. Even like few hours, he eat like 9 hours and throw up. Where does the food come from? So I don't get the soft. This is him. This is today. I don't get the. Oh no, this is last time.
Okay.
Last time it kind of severe. Last time,
Yeah.
yesterday. I mean yesterday.
And has he been eating the same food?
Normally it's DM, but then I changed some like a Hughes.
Yeah.
7 years old wet.
Okay.
Hughes, I checked this 2.5 fat kind of.
Yeah.
Okay. So this is I record. This is more severe. I think it's yesterday.
This is yesterday, is it?
And
This
you
is
can
throw up.
throw. Yeah, but interesting is not right. Where the time. Yeah, November 19. November 19. So I every time.
Yeah.
So I.
Okay, and you did the
Okay, this is
19,
November
okay.
19. So kind of soft, but today is kind of form, not so horrible.
Okay.
Okay, this is good one. This is November
this poop?
18. Yeah,
Okay.
November
that's good.
18. Yeah, this one is good. Then start to get kind of worse. So on and off. Oh, this is I have another cat. I'm going to see.
Okay. Well, I think what we should Is this throw up
No,
or is this is it
throw
poop?
up, yeah.
Throw up, okay.
November 17.
Okay.
So
okay.
I record each time.
Okay. And you said that the food, I think we should try and keep the food the same. Sometimes if we change foods, this can upset someone.
I didn't change the food until it keeps throwing for no reason.
Oh, that's when you started with the hills?
16? I think this is start the episode.
The start. Okay. So let's keep him on the food he was on before. So is that the DM? Is that what
DM? But because I'm still waiting for the WD.
Yeah.
You remember the one that you mentioned is no.
Yeah.
But I better wait for that.
One. Yeah, absolutely. But I would just keep him on one type of food for now. Okay.
The DM, I try to find the soft one, the mushy, but then they have no stock, so I have to squeeze it stock.
Yeah.
So I need a prescription for the DM.
For DM. Okay. Yeah, we can do that as well.
Okay.
What we'll do is we'll say hello to KK. See.
He kind of used to it now. I think he knows. He's much better.
KK. Oh, there we go.
Look at this cute. Oh, God, you make them.
Hello.
Look at this cutie. Look. Ay.
Good job.
7.63.
7.63.
Not so bad because he keeps vomiting.
Yeah.
He keep vomiting. It's not so bad. I expect like 5, 6. It's so cute.
So he is a little bit dehydrated as well. Okay, Mr.
Dehydrated, right?
Yeah, he's because a little bit dehydrated.
Because he's keep throwing up.
He's throwing up, exactly, yeah.
His eye is getting worse now. His eye purple. Remember last time it's better this time. I don't know why.
Good job. Good boy.
Yeah, I give him the ear medicine.
Ear medicine, okay.
Yeah, I didn't clean it lately for his throw up.
That's okay. You can make sure you just give the ears a clean at some stage, then, okay?
Mm-hmm.
Should go up to 40 for the height. Good boy. I know, my boy. Good job. Okay, mister. Okay, so a little bit of vomiting. And the poop, so is the poop being okay, or is the poop also not normal? What's the poop look like?
Soft, but today's better.
Okay.
Better is firm and soft at the end.
Okay.
Today is much better.
Okay. Okay, mister. Good job. Great. I'm just going to ask one of the other vets. When I felt his belly today, I think I can feel a little bit of a lump or a bump for some reason in his abdomen. Okay, so there shouldn't be any hard lumps or bumps in here. But there seems to be some kind of mass or some kind of ball or a lump in here, okay? Now sometimes it's poop and sometimes it's just a piece of poop. But I'm just going to ask one of our other vets just to see if they can also feel it, because if it is a lump, that would be a concern, okay? That, it's not normal, okay?
Okay.
Just give me one moment to see if...
Okay. 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 Mushy, mushy, mushy. Mushy, 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 mushy. Mushy, mushy, coi. Đây, coi sao ạ?
Hi, how
Hi,
are you?
doctor.
Is little KK, is this?
Yeah.
Sorry, my God.
No, he's okay. He's a good boy.
We got ourselves a hero.
African
Little kitty.
Okay, she's popped the DM just for the prescription.
I know,
For the guys.
you're okay. I know, okay. Kitty. You're okay.
Maybe if you just type in just DM.
Is she having like gastrointestinal signs?
That's okay. Yeah, so he's been vomiting the last few days.
Oh,
His poop's
okay.
okay, but he's been vomiting quite a bit. That's it. Thanks, man.
Okay, Pepe.
She said he's usually within an hour after eating. Yeah.
Not within an hour.
Not within an
No.
hour. Okay. Is it
2
soon?
hours
Or
later.
2 hours later.
Yeah.
More than 2.
More than 2
like
hours.
3, 4, 5, 6 hours later.
Oh, okay, so it's not really associated with feed time. It's kind of
Later.
later on.
Yeah.
Okay.
Not immediately.
Not
In
immediately.
the,
Yeah.
the cranial lobe?
Cranial. Yeah.
Yeah.
Like
Doesn't really
today,
feel like poop, does it? Doesn't feel like.
Yeah.
he just today 10:30 he just have poop.
Okay.
Yeah, and vomiting.
Okay. I see.
So it should be clean.
Yes. Yeah.
Yeah, no, I think you're right, chat.
Yeah. Okay.
I would say it could be an intersection either. I can feel what you're talking about, yeah.
Yeah. Okay.
Okay. But probably, I think you're on the right.
Okay.
Yeah.
Thanks for that.
Thank you, doctor. Thank you very much.
Okay, you guys. So Dr.
Oh.
McGuinness there, what he felt.
This is
well.
today.
Okay.
This is the score.
Okay. Well, that looks pretty normal to me. That's
And
good.
then at the end is soft.
Yeah. Okay. That looks okay to me. So what we're feeling in there is there's some kind of lump, okay, in the intestines near to the stomach, okay? So obviously the big concern here is if we have a lump for cancer, okay? Cancer is a very common thing that can happen in a cat's GI tract, so in the intestines or in the stomach. And it can cause signs like vomiting and diarrhea. What we'll do today is we're going to treat the problem. So we'll give you guys some anti-nausea medication, okay? Now the only thing is, after you finish the medication, if vomiting is still there, or certainly if we're vomiting even on the medication, he needs to get a scan, okay? He needs to get a scan of his abdomen, because that shouldn't be there, okay? Sometimes we can get lumps that form from pieces of poop that dry and that stick together. But as you said, his poop has been normal and he's been quite consistent. So I'd be very concerned there that there is a lump for some reason in his GI tract. And if it's a true lump, the risk for cancer is certainly possible, okay? So the only way to know for certain would be to do a scan. But just because that lump today is new, I'm a little bit worried. Well, I'm quite worried about that lump, okay? So we'll treat the problem today. We'll give him some anti-nausea. We can give him some fluids as well. But that lump there definitely isn't normal.
But you said after the stomach is duodenum. After the stomach is duodenum, right? Am I right?
After stomach is what?
It's called duodenum.
Duodenum, yeah.
Yeah,
That's small intestine, yes, yeah.
But that part is the pancreas issue too, right?
It can be,
it's
yeah.
not?
So it can be related. So the pancreas releases enzymes into the duodenum, into the small intestine. So if we have a pancreatitis, if we have angriness in the pancreas, this can also cause irritation to the small intestine. It doesn't usually result in a big ball, in a big I can even show you if you can feel, but usually it wouldn't feel like this pancreatitis, and usually it would be very painful as well. So I'll get you, if you with your left hand come in, the ball is between my fingers like this. So if you pop your hand completely under, and if you kind of hold like this, I'll see if you can't feel it, it's not a problem, but I'll just see if I can find it. So it's right behind the rib. So I'm holding it in my hands like this. Okay, so you go in there.
Yes.
And you see, you need to kind of squeeze the abdomen like this.
Like squeeze?
And
Big? Oh, okay.
you might see if you can feel it, just
I feel some tension.
some tension.
Yeah,
Okay.
some tension, but it's okay.